All right, welcome back. This is the Cut to the Chase podcast, episode 4. If you've seen the previous episodes, you know how this works. By the way, my name is Nick Pappas. I'm a board-certified orthopedic surgeon in New Orleans, Louisiana. The idea behind this is that everything is relatively quick. I usually have 3 topics, about 2 minutes each, so let's get into it. All right, first topic today, magnesium. So if you watch my social media, I talk about magnesium a lot. It does have a lot of musculoskeletal benefits. The main thing it can do is help relax muscle, which can be helpful for things like pain. But it also helps activate vitamin D, which can help make your bones stronger. So that's another reason I like it. Typically, I tell people you should try to get magnesium from foods as best you can. Foods like spinach and nuts are rich in magnesium. But ultimately, if you can't get it all from foods, and there's some studies that show that roughly 50% of Americans may be magnesium depleted, that's where supplementation can be helpful. And there are 4 main types that people often talk about when they talk about magnesium. There are certainly many others, but the one that gets the most publicity lately is probably magnesium glycinate. And that's the one that I actually take. The glycine in it essentially helps increase serotonin levels, so it may help you with things like sleep. So I do like to take that 30 minutes before bedtime, and I've seen good results with that. There's also magnesium citrate, which is better for supporting bowel motility. Another type of magnesium is magnesium threonate, and that actually crosses the blood-brain barrier. The idea is that can help more with cognition or supporting mental clarity. The other type that I do often get asked about is magnesium sulfate, and if it comes in the salt form, that's known as Epsom salt, and that is also a good muscle relaxant. Magnesium has plenty of benefits. You can't overdo it though. There are some downsides if you take too much, such as gastrointestinal issues. So always check with your doctor before starting magnesium or any supplement. But I have seen good benefits with magnesium, and I do take it regularly myself. And that's time. All right, next up, red light therapy. So for those who don't know, red light therapy is basically like taking the best parts of the electromagnetic spectrum and using them specifically to help heal your tissues. So you take red or infrared light, emit it from a source onto your skin, and you do this for something like 15 to 20 minutes per day. And what it'll do is it'll help activate your mitochondria, which can help increase ATP production and other cellular processes to essentially speed up the healing process. And it has been shown to even boost collagen production. So I like red light therapy. There are studies that show that it can certainly help with reducing scar tissue after surgeries, which is why I particularly like it, but it can also help with muscle relaxation, with wound healing. It's also been shown to help with improving fine lines and wrinkles as well as hair growth. So there are multiple benefits to it. There's little downside. The studies so far have been very promising in all these areas. More research is always needed, but so far I've been very impressed, and I use it on my patients to help reduce scar tissue after surgery. You can buy devices for home use, again, about 15 minutes per day, and you should see some results, often within 3 weeks or even less. There's even some studies that suggest that it might help with sleep, but again, more study is needed in that area. So I do like red light therapy, and I have seen benefits and do often use it on patients of my own. All right, last topic, osteoporosis. So I've done some recent videos on it. For those who don't know, osteoporosis is just basically significantly decreased bone density, and it puts you at risk for things like fractures. And some of these fractures, especially hip fracture, can have a significant morbidity associated with it. So always important to maintain your bone health to prevent long-term problems like these fractures. One of the things that surprised me when I started looking more into osteoporosis in medical school and residency is that roughly 20% of women over age 50 have osteoporosis, and about 5% of men. So it's not a small amount, and it's a silent disease with often significant repercussions. And it's difficult to fix. Once you get decreased bone density and get diagnosed, it's really hard to recreate new bone. We can try to slow it down or maintain your bone density, but it's difficult. So things I tell people in order to keep your bone healthy. And your peak bone density occurs at around age 30. So you need to start thinking about it even at a younger age. Number one, weight-bearing type activities. That's very important. There's a principle called Wolff's Law, which basically states that bones that see stresses stay stronger. And you absolutely want to do resistance training type activities or something to help keep that bone density up. Other things you can do are diet. Definitely look into consistently eating foods with calcium and vitamin D, which are important for bone health. And so things like salmon are great for that, as well as nuts and dairy products, like yogurt or even milk. If you still can't get it through your diet, supplementation can be considered. However, always check with your doctor before doing that. If you have a history of heart disease, you may not want to take calcium supplements. So check with your doctor, but calcium supplements can also be helpful, as can magnesium supplements, because magnesium actually helps vitamin D work, so that can also help maintain your bone health. Other thing would be if you're postmenopausal, you could consider hormone replacement therapy, and some people may consider actual medications like bisphosphonates, but again, that's something you want to check first with your doctor to see if you're an appropriate candidate for that. And that's time. All right, that concludes episode 4. Thanks so much for tuning in. We're going to do this every week. So if you like this short, sweet format, cut to the chase style, follow us and stay tuned for more.